Good afternoon, everybody. Welcome. Today is Thursday Thoughts for April the 30th, 2020. And while the COVID-19 epidemic has taken up most of our time and most of our attention today, we're going to talk only indirectly about COVID-19 because we're going to talk about the immune system. So our subject for today is sugar, alcohol, and the immune system. The subject of the day is not sugar, alcohols, and glucose. There was a bit of a miscommunication with our staff, and Natalie sent out the email and said, let's talk about sugar alcohols. No, Natalie, I did not make myself clear. I apologize. So she's wearing the dork cap for the day, but maybe it should be me.
All right, so I'm going to start off by saying if you are a patient of Dr. Campbell's, you've heard her talk about you have to eat clean food, you have to drink clean water, exercise most days of the week, 7 to 8 hours of sleep every night, pray or meditate daily, practice gratitude, and spend time in nature. It sounds like we harp on that a lot but we do because it's so fundamental to everything in health. Self-care is healthcare. And Dr. Campbell actually said this to a patient today, and I just loved it, that it just doesn't matter what's the matter with you, the building blocks are all the same. And I don't know about y'all, but I can really relate to that. So I included it for your benefit. And during this time of quarantine, a lot of our patients are reporting overindulging in sugar or alcohol. And so we thought it would be a good idea to talk about that and what it looks like in the body and what it's doing to your immune system. What this is not meant to be is wagging our finger at you or, making you smell the dirt of your decisions or whatever. But we just have found over and over and over again that education is key in choosing health behaviors. You have to know why you're doing what you're doing. That said, we want to make sure that to also talk about implementing accountability partners, thinking about behavior tracking, health coaching, things like that, that also help you with the knowledge that you've learned. Remembering that you are individual and unique, and therefore any dietary recommendations are individual and unique as well. We really truly believe you are an N of one. And that a lot of the research that we found when we were looking through this topic is for people who are not just occasionally binging, but have long-term use issues with sugar or alcohol. So we're going to follow the science that we know, and we're going to talk about short-term and long-term implications.
And I don't think I introduced, I think everybody on the call knows Heather Williams, our amazing health coach. But for those of you who may be watching this on a recording sometime in the future, that beautiful voice and face that's speaking to you is Heather Williams. She's a nurse with extensive training in the hospital and a functional medicine recovery success story who found it so helpful to her own journey that she became a certified health coach. And so now she's a super valuable asset to every single patient at Campbell Family Medicine. And health coaching helps you be accountable. And that's one of the things that is often lacking in a successful program is a coach, somebody to help you talk through it. The best athletes in the world don't go out there and do what they do without their coach. So the best patients often do best when you have a health coach as well. All right, back on to the presentation.
Thank you for that. I forgot to introduce myself. Ultimately, our goal at Campbell Family Medicine is to keep our patients healthy. The foundation of good health is going to keep our patients out of the hospital. It's going to keep y'all alive, and it's going to reduce complications of viral infection if or when you do end up ill. So we want to continue these foundational good behaviors so we can keep you healthy. And we love our patients, and that's why we want to share this information. So really quickly, I'll go through what happens when you eat sugar, and Dr. Campbell's going to talk more to the science of all of this. But basically, what happens is we eat sugar, And then our brain lights up like a pleasure. It's just like, yay, I got some sugar. There's dopamine, there's serotonin.
The same places that are lit up as if you did cocaine. It's
correct.
The same centers in your brain.
Mm-hmm. Sugar is really like a drug to our brains. You get a short-term energy boost as your blood sugar is going up. And then your insulin is released. It's how your body puts sugar away, because your body doesn't really like sugar to be in the blood. So it's going to start with the cells. It's going to put sugar in the cells as much as it can. And whatever's left over, it's going to pack away in the liver as glycogen. But the rest has to be stored as fat. And that might be fat on your abdomen. It might be fat around your organs, like your liver or other visceral organs. And then as the insulin is done packing all of that sugar away, you're going to feel your blood sugar drop. And that's when you get that energy crash. And that might be just feeling sluggish. It might be so much that you actually want to take a nap. You might feel really thirsty and want to take lots and lots of water in, or you might feel hungry again and then start the cycle over.
I want to take you back 50,000 years in human evolution. And I want you to think about our ancestors when they were out hunting and gathering. Fruit mostly ripens in the late summer and early fall. And so, except for honey, this is the only time in the seasons of the year when ancestral humans were exposed to sugar. It was in the form of ripened fruit. So all the apples come ripe at the same time. All the berries come ripe at the same time. And without refrigeration or the ability to dry and store these things, we just had to eat what was available. So we ate lots and lots and lots of ripened things all at the same time. So whether the sugar comes to you in sugar sweetened honey smacks, or whether it comes to you in honey, or whether it comes to you in the form of fruit, it's still sugar, and your body takes it the same. Modern man has concentrated the sugars so that they're much more dense and many more calories in a cleaner fruit, so that sugar in the fruit has fiber, and fiber dulls ever so slightly, actually moderately, the sugar response, the sugar spike that you get from that. So if, let's say, a piece of fruit had 10 grams of sugar in it, a very ripe piece of fruit, if you ate 10 grams of sugar from a teaspoon, it would spike your sugar very fast. But 10 grams of sugar in an apple, that is a large apple, that is mixed with fibers and pectins, will not raise your sugar quite so quickly. So the insulin response is not as profound. Why is this important? Because historically, 50,000 years ago, we're eating all the fruit that we can. And the number one job of insulin is to store it as fat, to store sugar as fat. That's the primary job of insulin. Why is that important 50,000 years ago? Because winter is coming. We need to pack on fat. We need to fatten up for the winter. Otherwise, we risk freezing to death or starving to death. But if we have a nice insulation of fat around us, we'll probably winter over and survive till spring. So the primary job of insulin is to store fat. If there's any extra sugar molecules floating around our bloodstream, the remainder of that insulin will be used to tackle the sugar. But the first job is to store it as fat. So we don't want a high sugar spike. We don't want a high insulin spike, because its job is to use sugar to feed the cells once it's been stored away as fat. Right? So in today's society, we get exposed to sugar 24/7, 365. There's no seasonality to our sugar any longer. And our bodies have had to compensate for that. All right, so what does sugar do to our gut, Heather?
So sugar in our gut actually is going to affect our microbiome. It feeds bacteria and yeast that we don't want overgrowing, because when those bacteria and yeast overgrow, they're pushing out the good bacteria that help us to live healthy lives. But most of our immune system and much of our microbiome is in our gut. It's living there. And so when we are eating sugar, we're exposing our immune system to all of that. And keep in mind your gut starts in your mouth. And Dr. Campbell is often talking to us about oral health. Sugar is going to affect our oral health as well.
Significantly. Although interestingly, it's not sugar that causes cavities. It's the acids from the bacteria that ate the sugar that cause the cavities. And so avoiding sugar, humans have a sweet tooth. And most humans really love the flavor of sweet things. You can bypass this slightly if you use natural sweeteners, such as the stevia plant or the monk fruit plant. These are reasonable replacements for sugar. I'm not a big fan of agave syrup. I was for years, but agave is mostly fructose. And what's interesting about fructose is that it doesn't spike the glucose reading very much. So people got the impression that it was safer for you than sugar, but it equally spikes, or even to a greater extent, spikes insulin. So agave and other fructoses, especially our high fructose corn syrup, cause this insulin spike that causes all the detrimental things that we talked about, including packing on fat. So monk fruit and stevia seem to be okay. Xylitol is an acceptable sugar alcohol that we will briefly mention. In general, you have to be careful with most sugar alcohols because they can cause diarrhea when taken in extra amounts. What about honey? I think honey is Mother Nature's intended sweetener for us. It comes naturally, but it does have calories and it will have glucose in it. So it causes many of the same issues that sugar does. So honey in moderation, not a bad choice. Honey in excess, no better for you than sugar.
I thought this was an interesting comment from when we were looking around at what the literature had to say. Often when we are choosing foods that have added sugar, we're avoiding, we're saying yes to something and saying no to something else at the same time. So often when we're saying yes to sugar and treats and dessert, we're saying no to fruits and vegetables. So keep that in mind when you're making your choices for food. Also, when our bodies are putting away the sugar and dealing with it, we are using antioxidants that could be used elsewhere. So just something else to keep in mind. Let's see. So as I said in the beginning, we were going to talk about downsides to long-term sugar use, just as a reminder, something to keep in the back of our minds as we're making our food choices. Initially, when we're eating lots of sugar, something that happens is called insulin resistance. Our cells become less and less accepting of the insulin to move the sugar into the cell. And that can become a problem because then our pancreas is having to work a lot harder and push out more and more and more insulin. And it becomes unhappy, like the guy in the corner here.
So many of you are stuck at home during quarantine from COVID and the children are running around the house. At first, you hear the children screaming and you can't, and you're quiet, quiet, I can't do my work. And eventually those screaming children become background noise. And you don't even hear the children anymore. It's screaming, 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 but you don't hear it. That's what insulin resistance is to a cell. The insulin is pounding, 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 and the cell can't hear it because it's been pounding so long. So no longer does that cell machinery work very well. So we don't want that high insulin to be present. Also, there's some theories that your pancreas has a finite amount of insulin that it can make. And once you've exceeded that event, you'll burn your pancreas out and you'll be a full-on diabetic. So we don't want insulin resistance. It's not the path of no return. That's the best news of all. But it's a path that leads to a dangerous place, including that unhealthy liver. So look at that little unhappy brown liver in the second half of that picture. There's alcohol in one hand, fast food in the other, and a cigarette in his mouth. That is not a happy liver. You want to have the happy liver that's eating apples and broccoli.
Love your liver. If you've done our detox, you've heard that before. Also to keep in mind with long-term sugar use is the shrinking of your brain. Dr. Campbell's probably talked to you about if your A1C is above 5.3 3, that's when we start seeing the shrinking of the brain. So that's why we're always promoting a lower, stable blood sugar over time.
Some people call Alzheimer's disease diabetes type 3. It's in fact because the high blood sugar levels literally rust that brain. Look how unhappy and rusty he is. We do not want that brain shrinkage, and keeping blood sugar levels under control is something you can do to reduce your future risk of dementia.
Mm-hmm. So obviously diabetes is something we've talked about as a long-term consequence, but also high blood pressure, eye disease, kidney disease, any organ that is fed by small blood vessels would be impacted by chronically high blood sugar levels. And then Dr. Campbell was going to explain to us what this is.
Yeah, I do. I want to go back one slide because we talked about tiny blood vessels, and one thing that's not on there, since there's no dudes on here, we'll go ahead and say it out loud. The penis. Those are blood vessels that are highly affected by blood sugar abnormalities. And I often will say the penis is the dipstick of health. And if it's not working, something in that system is not working, right? And often it can be plumbing, electrical, or hormonal, but very often it's this insulin resistance problem. And we fix that and there's no need for Viagra. So, all right. So this is from a medical journal, and basically it says that when sugar comes into the cell, it has to bind to a protein, and when it does, it gets pushed down a pathway that causes what's called advanced glycated end products, AGEs. And one of my mentors just called these sticky buns. And he said, imagine that you're eating sugar, anything that's sugary, including too much fruit, and now you have nothing but sticky buns floating through your bloodstream. You can imagine how that would be a negative health consequence, that these glycated proteins are highly abnormal. They may be part of the trigger for autoimmune disease. They may be part of the trigger for these advanced oxidative stress markers that they burn through your antioxidants, right? So if you think about antioxidants like fire extinguishers, you have all these oxidative stressors from all these sticky buns in your bloodstream. You cannot swallow enough vitamin A, vitamin E, vitamin C to quench all those fires. And you end up with little holes burnt in all of your blood vessels, including your brain, your kidneys, your eyeballs, and your penis. We move down to the next section in there in the Krebs cycle. Whenever we do a urine organic acid test and we're looking at your Krebs cycle, we're looking at the electron transport system and the ability of your cells to make ATP or cellular energy. And if that becomes impaired, the symptom people describe is fatigue. So too much blood sugar knocks the system out. You get too many sticky buns and not enough cell energy. It's a bad consequence, and it simply came from sugar. And you can modify it. Mm-hmm. And it doesn't take very long. There's good news, Heather. Tell them the good news.
Yes, it's never too late to make changes. And it doesn't matter if this last month or two you've screwed up, you've been binging. We can do something about it because we have tools. Research shows it only takes about a week to get better control of your blood sugar. And this takes us right back to the things that Dr. Campbell's always saying to us. We're going to decrease our sugar intake, and then we're going to go and eat clean food, which includes fiber, which helps that blood sugar. We're going to drink clean water. And now, I have to say this, anytime I talk about fiber, I talk about increasing your water consumption because you do not want cement poop, because that is what will happen if you increase your fiber without water. Also, exercising most days of the week. Our muscles actually burn sugar, so we want to do exercises that build muscle. So that way we can continue that cycle of burning sugar. And then managing stress is also a good way to help reduce our blood sugar. So praying, meditating, practicing gratitude, getting out in nature, that's the entire list we went over at the beginning. All of it helps to mitigate blood sugar issues.
And the dudes, when they think about exercise that build muscle, they always think about this muscle, right? That's the one they really want to see, their delts and their biceps and their triceps. But those are, relatively speaking, not very big muscles. So let's use our glutes, let's use our thighs, let's use our core muscles, because those are much bigger muscles and they burn sugar much faster. So a few minutes of wall sits or a few minutes of planking can get you way farther in terms of glucose control than hundreds of curls and whatever they call those other exercises with
tricep dips and all of that.
Fit, yeah. So go for the big muscles. Go for the biggest bang for your buck. And then don't forget to manage stress, because cortisol and adrenaline raise sugar. If you're about to be eaten by a grizzly bear, your body wants you to have a spike of sugar. Your liver will make sugar and dump it into your bloodstream, even if you haven't eaten any sugar. It is so important that your brain and muscles get sugar if you're about to be eaten by a grizzly bear, even if you've been starving for weeks on the savannah and there's a lion about to chase you, you need to make sugar. So stress makes you make sugar. We can mitigate that stress because in today's society, there's not many literal grizzly bears and lions. But there's this many emails and this much time and this many bills and this much money and relationship stress and being pushed from the seniors to the children and in between. Those stressors can be mitigated substantially with prayer and meditation and gratitude journaling and Shinran Yoku, which is forest bathing in Japanese, time in nature. We can reboot our sympathetic nervous system and get it out of fight and flight by practicing parasympathetic biohacking, those things we just talked about, prayer, meditation, gratitude, time in nature. They lower your blood sugar level because they lower your stress.
All right, so
switching gears a little bit, let's talk about alcohol.
Yes.
I confess guilty as charged. Coronavirus has led to trials of many different quarantinis that I didn't have exposure to before. I've tried all kinds of things I don't normally drink. Spending a lot more time on the deck in the evening with my husband because I can get home from work at a reasonable time because the patient volume is much less because we do a lot more telemedicine and a lot less inpatient care. So I get home a lot earlier, and I confess I've had more alcohol than usual. Let's talk about why it's important, Heather.
Right. The segue I think is important to mention is that a lot of times alcohol and sugar go hand in hand. So everything that we just talked about with sugar can be, assigned to this discussion about alcohol if you're drinking beverages that are like mixed drinks that have the added sweeteners to make the alcohol taste more appealing. I don't know about you, but I don't want to do shots of tequila or whiskey or vodka to avoid the sugar if I'm going to drink. But that's why I thought it was important to share with you the lowest sugar content alcohols: beer, gin, rum, tequila, vodka, and whiskey. So if you're getting sugar, it's what you're adding to make it taste better. Minimal sugar content was light beer or dry or medium dry, a dry wine or a medium dry wine. And then more sugar content was the sweet wines and mixed drinks. So just keep in mind the sugar conversation does apply here as well. We also want to talk about what's considered acceptable, what the guidelines say. Generally, 1 drink per day for women and 2 for men is what the recommendations are. If you find yourself needing a drink on a daily basis, it's something that we want to talk about. Bring that up to Dr. Campbell if she's your doctor. She says this even, it's not just alcohol, it's with all things that are potentially addictive: sugar, caffeine, other things. Caffeine is my vice. So, it's something that we do want to think about. Also, social isolation can mask overuse or abuse of alcohol. So please check on your neighbors. When we are more socially isolated, those of us who have trouble saying no to alcohol might be drinking it more. And when we check on our neighbors, it's that personal relationship that helps with all sorts of things, depression and all kind of mental health issues. So just
Yeah,
keep
if you
that in
call
mind.
Betsy next door and she says, oh, you're running to Costco, could you bring me a case of toilet paper and a case of wine? You might want to have a deeper conversation with her, right? And it really is easy to get overindulgent when you are living alone and there's nobody to put on the brakes or check in for you. So please do pay attention. I make a little joke about it, but it is really a serious issue that we don't want to make light of, and getting worse as more people, as the longer the quarantine goes on.
Also keeping in mind that drinking patterns, beverage type, the type of alcohol or amount of alcohol you're choosing, whether or not you are female or male, they're all going to influence the way that you personally are going to absorb alcohol and the impact that that's going to have on the immune system. Do you want to speak more to that, Dr. Campbell?
Yeah, I just want to say that in general, we say 1 for women, 2 for men is a safe amount. It is much more typical that you'll have nothing for 1, 2, 3, 4, 5 days in a row, and then 2 or 3 in a single sitting on a Friday or a Saturday night. And that is a problem because there are direct effects that alcohol will have on your GI tract that are minimal with 1, but pretty significant with 3. And so you might want to think about choosing some alternatives. My personal favorite is a bubble with a splash. So in a wine glass, we fill it up 3/4 of the way or 9/10 of the way with carbonated water, usually LaCroix, and then top that off with a tablespoon to a shot glass full of pomegranate juice. So it's red, it's in a cocktail glass. It looks like a cocktail, and it's fizzy and it's light and it's full of antioxidants from pomegranate juice and not a lot of calories. You can make it just a blush, just a teaspoon or so, and make it more rosé looking, or you can make it look like full on burgundy if you add enough pomegranate juice. So again, there's a modest amount of sugar, but if you read the label on the pomegranate juice, a serving size is in ounces, and I'm talking about milliliters for your serving of pomegranate juice. So you can still enjoy your social experience without the negative effect of either the sugar or the alcohol.
I think I'd like that with lime juice.
Yeah, lime juice is another one way to go. Grapefruit juice, same deal. Put a little flavor in there without the calories and sugar.
All right, so alcohol and the immune system. I'm going to let you go over these.
Clinicians have long observed that there's an association between excessive alcohol use and adverse immune related effects such as pneumonia. We know that alcoholics, for example, are particularly susceptible to pneumococcal pneumonia. When the Pneumovax vaccine first came out, it was targeted sort of for that population of people with heavy alcohol use because the alcohol impairs that particular part of their immune system that attacks those types of bacteria. And so that's the chronic use of alcohol damaging the immune system. But it also disrupts the immune pathways in many complex and even what we would call paradoxical ways. For example, it can impair the cytokine response. Is that on the next slide? Yeah. Maybe not.
It's coming.
Okay, so chronic alcohol use is a problem, but acute alcohol use, even one single episode of binge drinking, has measurable effects on the immune system. It causes a slight increase in the pro-inflammatory state within the first 20 minutes. Why is that a problem? Well, let's say you have elevated myeloperoxidase and LPPLA2, markers that we have seen on your Cleveland Heart Lab that suggest you are in a higher state of inflammation. Often that inflammation comes from dental sources, and the arteries themselves are inflamed. Now you add to that alcohol and you kick up your inflammation even higher. That might just be the triggering event for a heart attack or a stroke. Yikes, right? That single episode of an alcohol binge might be the trigger for a lifetime of consequences. Then after 20 minutes, you're kind of in a relatively safer zone for a little while because the alcohol actually then dampens your immune response. In some ways, lowering it to below baseline levels, resulting in an anti-inflammatory state that lasts for somewhere around 2 to 5 hours. And so many people will find that this is the time where they feel best, right? That 2 hours after the alcohol. And this is why people with chronic pain will often seek alcohol as a treatment, because for a couple of hours following their binge, they feel better because they've knocked down the inflammation. We know also that depression is often inflammation in the brain. Some people are choosing alcohol as their drug of choice to treat their brain inflammation, which is depression. So in the short term, they feel a benefit, but we know the long-term consequences are worse than the short term. But it's hard to say no when you're suffering and you have nothing else in your house to help you except for a fully stocked liquor cabinet. Alcohol, we know, in the short term impairs judgment and clear thinking. Many of us in college recognize all the dangers that we got into when we made poor decisions after one too many drinks, went home with someone we would never have gone home with had we been sober. We walk into crazy situations and climb into the steam tunnels and go into what was the name of that? At the University of Illinois, we have a agricultural cornfield that is so old. It's such a part of the agricultural part of the university that when the library was being built, the most important thing was not to throw shade on the garden. So they had to build the library underground to protect the cornfields. And you're not ever allowed to go in there unless you've had one too many drinks on a weekend, and then you get to go into the cornfields, which is something you would never do if you had unimpaired judgment and clear thinking. Alcohol will do that to you.
You know, it's interesting. I was an ER nurse for many years, and most of our injuries, at least a third of them related to alcohol. So keep that in mind.
Right. You get on your bicycle when you shouldn't, or you try to do that trick you saw on YouTube that you would have no business trying had you been unimpaired. But we know also, we talked about this briefly, that it impacts the gut microbiome and including the oral cavity. Alcohol also impairs directly those immune cells that help fight infection, and it can even damage the epithelial cells in the lungs. So you think about a topical effect, toxic effect by drinking the alcohol. Okay, I can understand how alcohol might kill any baby cells in my mouth or down my throat, but it also impairs the epithelial cells in the lungs. It dampens your innate immunity's ability to fight infection, delays wound healing, especially when consumed chronically. And then more than 4 drinks impair the signaling protein of cytokines. This is one of those paradoxical effects that we talk about, right? In COVID-19, we know that one of the things that kills people is the cytokine storm. So what are cytokines? They're chemical signaling molecules that are inside little pockets because they can digest the cell. So they're kept inside little pockets, and then they're released to try to kill the invader. More than 4 drinks actually impairs that, which would seem like it would be a good thing if you're being infected by a COVID-19 SARS-CoV-2 virus. But in most instances, you need that cytokine effect to kill the invader. So that's how come alcoholics will often suffer from infections as their final cause of death. And over time, overuse, abuse, and long-term use of alcohol cause neuroinflammation, memory issues, increased risk of head and neck cancers because of the chronic inflammation of the epithelial cells, not to mention gastritis, pancreatitis, and hepatitis, leading to cirrhosis and liver failure.
So I wanted to make sure we talked about considerations, which Dr. Campbell already mentioned a few things, like making a pretty mocktail in a special glass. That's you still get that feeling even if you're not getting the beverage. But also I wanted to talk about considering boundaries. Many of us had a set of boundaries that we lived by prior to coronavirus affecting our world. Maybe it was I only drink on the weekends. Maybe it was I'm only if I'm in a social situation. And now we're at home and, oh, I'd like to have a glass of wine. Oh, but it's, only 2 o'clock. So some of our boundaries have changed. And, like we've said in previous publications, it's important to create a schedule. Well, boundaries around this might go on that schedule. If you're going to consume alcohol, when is it appropriate to do so? And in what situations? Me personally, I know that if I'm sad, I cannot drink. It makes it so much worse, and I end up crying. So that's a personal thing that I know about myself that I don't mind sharing, but it creates a bright line for me. If I'm sad, no alcohol. And so it might be something for you to consider. What do I know about myself to be true that can help me create some boundaries around alcohol use? And then if you are going to drink, considering having water for every alcoholic beverage that you consume, because it helps to keep you clear-headed, it helps keep you hydrated, and water's just good for you. Also, drinking with your meals does slow the absorption of alcohol and will help your blood sugar as well.
Might want to have that mocktail before the entree arrives.
Right.
And then your wine with your meal.
So keep your personality in mind. You need to know yourself. I don't know how many of you know of Gretchen Rubin, but she's one of my favorite authors, and she has studied happiness and how behavior and habits affect happiness. And she tells us to learn more about ourselves so that way we can meet our goals. One of the things she talks about is, are you an abstainer or a moderator? And so this is important to talk about, whether it's alcohol or sugar. Abstainers have an easier time just saying, nope, I don't want any. It's easier for them to say no than to say, I'll have a little bit. And often the example that's used is, can you eat 1 square of chocolate and put the bar of chocolate away? I personally cannot do that. And I know that about myself. I do better if I abstain. It's easier for me to say no. And then I'm not thinking, well, when can I have it? And how much can I have? And all of those questions that are running through my brain. So I use less time and energy, and I'm not as stressed if I just say, I don't have that. But moderators, that makes them very stressed. The idea that they might not ever have something again. And they can have the 1 square of chocolate. They can put it down and it doesn't bother them. So it's important to know that about yourself, and also to know that you might be a moderator about one thing and an abstainer about another. So keep that in mind. The other thing that Gretchen Rubin talks about is how we respond to expectations. So an upholder is someone who responds to inner and outer expectations alike. Someone who says they set a goal for themselves and they say, this is how it's going to be, and then they meet that goal, no problem. But actually, most of us are what she calls obligers, where we tend to meet others' expectations more readily than we meet our own. And these are the people who tend to do better with a health coach, because it provides accountability. And if you don't have access to a health coach, it can just be an accountability partner in your life, someone who wants to meet the same goals that you have, that can help keep you on track. The other 2 categories, just because they're there, I'll explain them. A questioner is someone who wants to know why before they meet the inner or outer expectation. And then a rebel is someone who's not going to meet the expectation, whether it's themselves or someone else, just because they don't like to be pent up by rules. So I think it's really important to know yourself, and there's a whole lot of different ways you can learn more about yourself and kind of pin down who you are to help you with all your goals, including sugar and alcohol consumption. So any questions? Unmute yourself.
Let me unmute everybody here. I can remember how to do it.
Michelle, did we answer your question completely about the honey and the sugar and stevia?
Yes, I think so. But Dr. Campbell said honey's okay in moderation. What's that?
Not more than a couple of teaspoons a day.
Okay, so like if I make muffins using honey and I eat 1 muffin, then that should be okay.
Yes, not the batch.
Okay, gotcha. And then is there a limit on how much stevia you should use a day?
I don't think so. Heather, do you?
I have seen that there's speculation that stevia can affect the gut microbiome, and so less is better. But I have found with people it's more of a titration process. You know, as if you're using it to get rid of sugar, you may need more, and then over time you can kind of cut yourself down. But I don't know that there's a hard and fast rule about how much.
Okay.
And I would say that in general, most people will find that if they completely abstain from everything sweet, when they do indulge in anything sweet, it's too sweet, it's unpleasant, and they don't really want it. So I think that that's, in general, a good life habit for us, is to avoid sweet. We know, for example, that the diet drinks are really terrible for us. The aspartame and the sucralose, these artificial sweeteners, we thought that because they were artificial and didn't have calories, that they had no consequences. But that's not true. They may spike insulin, much the same as sugars do, and they trash our gut microbiome for sure. Switching it to one that actually burns or absorbs excess calories from the food compared to before the artificial sweetener. Meaning, you eat 10 calories, you turn 10 calories to fat instead of turn 5 calories to fat and poop out 5. The microbiome will turn those calories to fat when you eat artificial sweeteners. So we want to steer clear of those for many reasons.
Dr. Campbell, I missed earlier. I missed the first 30 minutes. Not that I wanted to, but I just got tied up in something.
You can watch the recording.
That's what I was going to ask you, is where's it going to be? Because it sounds like you just, I don't drink, so I didn't need that. But blood sugar levels, yeah, I need to hear what you were saying.
Yeah, it'll be on the Facebook page, and probably we can figure a way to special delivery a copy just to you if you need one.
Oh, well, thank you. If you can.
Okay. Yeah.
Otherwise, I'll look on Facebook. Okay, thank you.
You're welcome.
If you're going to have fruit during the day, what's the limit? If you're supposed to watch your sugars, what limit should you have on fruit?
Heather, you want to take that one, or you want me to?
Again, it depends on the person. I think.
And the fruit.
Yes, definitely, and the fruit. I think it's important, number one, to watch serving sizes. A lot of times we eat fruit and we aren't watching our serving size, so keep that in mind. Also, it depends if you're struggling with things like yeast, because we're going to limit even natural sugars if yeast is a consideration. I did the yeast diet, I don't know, years and years ago, and I remember I was limited to 1 fruit a day, if that, just to really get rid of all the yeast that was growing. Which was really helpful. Also, something that's really helpful around fruit is if you eat it by itself with several hours on each side, and that's going to just naturally cut down on how much fruit you eat in a day if you use that method. And that is just because of the different fermentation rate. It ferments faster than other foods and can create some gas and bloating. But most of the time, I don't make blanket recommendations, but I'd say 2 or 3 servings a day is probably a good, healthy idea. And then you want to choose fruits that are dark in color because they have more phytonutrients. Berries have more fiber. Grapes and bananas have the highest sugar of the fruits. And then your fruit is going to have more sugar if it's more ripe. So if you could go less ripe, then you'll have less sugar.
And also, I think portions are important. When my husband shops, he always likes to buy the biggest fruit that he can find. I always shop for the smallest fruit that I can find. So when I'm shopping for apples, I look for the really little ones. If I buy a pineapple, I look for the really small one. I think they're a little bit sweeter, but you can easily overindulge if you're going to try to eat an apple that's this big, or a pear that's, as big as your face. So choose the small ones. That naturally limits 1 piece of fruit equals 1 portion size. So that's a little tidbit that can help. Berries are generally a safer fruit. 1 cup serving of berries is a lot of berries. especially if they're strawberries or raspberries, and you put them in a measuring cup and then put them on the plate. It's a lot of berries. One apple, one pear. Those are generally lower glycemic fruits and generally acceptable. When it comes peach season in the summertime, those are highly dense sugar fruits. So choose the small ones. They tend to be sweeter and tastier anyhow.
Did you say, oh, am I unmuted?
Yes, you are. No,
Did you say ripe bananas have a lower glycemic? I thought the unripe ones.
correct.
Mhm.
The
greener
riper
the-
the fruit, the higher the sugar.
Okay, so the greener the fruit, the lower the sugar, right?
Yes,
Right.
correct.
Okay, thank you.
All right. Anybody else?
Dr. Campbell, what do you think about seltzers? Like, you know, the new Corona seltzers and things like
Yeah.
that, where they're the
You mean
alcohol's
like
made from the
the
sugar?
alcohol seltzer ones? I'm not sure what I think about them yet, to be honest. Certainly there's seltzer water, so there's more calorie free than calorie in the can. So that's helpful. But they are made with cane sugar. So there's a sugar content. The Truly ones, my young adult daughters like, the 20s. I don't much care for the flavor of them unless I throw in a shot of pomegranate juice. So what's the point of that? I'd rather choose something that I enjoy rather than suffer through something that I don't. I don't know yet. You know, for a long time, we thought that seltzer waters were perfectly safe and you could have as many as you want and there were no consequences. Now we're starting to wonder if that's not true. Perhaps the carbonation may have some effects on bone metabolism, worsening osteoporosis perhaps. There may be issues of pH in the gut affecting the microbiome. So seltzer water may not be a totally free food like we thought. Drink as many as you want, 12-pack in a day, no problem. Certainly you can have 12-pack of regular water, no problem, but maybe not for seltzer. Jury's still out. Stay tuned. We'll tell you more as we learn it.
Thank you.
You're welcome. All right, ladies, it's just ladies today. So thank you for your participation, and I will stop the recording and we will sign off. And you're welcome. We'll post the recording soon.
Okay.
See you next.
Thank
You want to
you.
do this next Thursday? We'll do it again if you all like it.
Yeah.
Yeah.
Yes, ma'am.
Okie doke.
Thank
Sold.
Nice to
You're
see all
welcome.
your faces today.
You too. Bye, everybody.
Well.
You too.